Hello guys, my name is Maylenis and along with Adriana and Reyes, we made this amazing presentation about autism. I hope you guys enjoy it.
An autism is a serious development disorder that impairs the ability to communicate and interact with people. Effects caused by autism spectrum disorder. The first one is getting upset by slight chance in a routine. Second is tending not to look at or listen to people. Third, fail to respond to his or her name or appears not to hear you at times. Fourth, has poor eye contact and lack facial expression. Fifth, is unslightly sensitive to light, sound, or touch, yet may be different to pain or temperature. 6. Prefers to play along. 7. Does not share interests with others. And lastly, repetition in language or movements. The total cost per year for children with autism in the United States were estimated to be between 11.5 billion to 60.9 billion 2011 US dollars. The significant economic burden represent a variety of direct and indirect costs for medical care to special education to last parental protected. Children and adolescents with autism had average medical experiential that exceeds those without autism by $4,011 to $602,000 per year. On average, medical experience for children and adolescents with autism were 4.1 to 6.2 times greater than those without autism. Difference in medical expression range from $2,000 to $240 to $3,360 per year, with medium expression 8.4 to 9.5 times greater. In addition to medical costs, intensive behavior intervention for children with autism costs $40,000 to $60,000 per children per year. In 2005, the average annual medical cost for medical care enrolled children with autism with $10,709 per children, which was 6 times higher than cost for children without autism, $1,800. So you will see the data and statistic on autism spectrum.
Physiological events. People with ASD often have problems with social, emotion, and communication skills. They might repeat certain behavior and might not want to change their daily activities. Many people with ASD also have different ways of learning, paying attention, and reacting to things. Signs of ASD begin during early childhood and typically last throughout a person's life. Children or adults with ASD might not point at objects to show interest, avoid eye contact and want to be alone, have trouble understanding other people's feelings and talking about their own feelings, repeat action over and over again, have trouble adapting when a routine changes, have an unusual reaction to the way things smell, taste, look, feel, or sound. Is autism genetic? What systems are affected by ASD? What is causing autism? Autism spectrum disorders can be the result from an interaction between genetic vulnerabilities and environmental factors. When a child with genetic susceptibility and low nutrient levels in cell membranes is exposed to one or more environmental insults, cells can malfunction, resulting in abnormal behaviors. This can happen during pregnancy or after birth. Eventually, these dysfunctional interactions can affect body systems, most obviously the gastrointestinal, endocrine, immune system, and the central nervous system. Recent research examined the genomes of parents and siblings of thousands of children with ASD. Their findings suggest that autism is associated with new mutation as well as inherited mutation, and that both increase the vulnerability of children to environmental insults and poor nutrient levels, leading to ASD. This chart shows the collected information by AADM network sites on intellectual functioning for at least 60% of children meeting the ASD case definition. Similar portions of cases among boys and girls had information on intellectual ability, 80% versus 78%, as did white and black children, 81% versus 79%. Across the state, greater absolute variability was reported in the prevalence of ASD without intellectual disability than ASD with intellectual disability. Among children meeting ASD cases status who has IQ information, 33% were classified as having intellectual disability, IQ less than 70, at their most recent test or examination. 24% had an IQ in the borderline range, IQ 71 through 85, and 42% had an IQ in the average or higher range, IQ greater than 85. The percentage of children with co-occurring intellectual disability varied by sites, ranged 25% New Jersey to 42% Georgia. Overall, a higher percent of girls than boys was classified as having intellectual disability, 40% versus 32%, and Black and Hispanic children were more likely than white children to classify as having intellectual disability, 47%, 36%, and 27%. Treatments. There is currently no cure for ASD. However, research shows that early intervention treatment service can improve a child's development. Early intervention service help children from birth to 3 years old, learning important skills. Service can include therapy to help the child talk, walk, and interact with others. Thereof, it is important to talk to your child's doctor as soon as possible if you think your child has ASD or other developmental problem. What should we do if a child is not yet diagnosed with autism? Even if your child has not yet been diagnosed with an ASD, he or she may be eligible for the Early Intervention Treatment Service. The Individual with Disability Education Act says that children under the age of 3 years who are at risk of having developmental delays may be eligible for service. These services are provided through an early intervention system in your state. Through this system, you can ask for an evaluation. The sooner the better. Help your kid.